what is known from the human side, the majority of information is actually gained by post-mortem analysis of people that died from COVID. And you know that, I mean, COVID is a terrible disease, but only 1 or 2% of all persons that, you know, come down with the disease actually die from it. So we are only looking at a very small fraction of patients, you know, only maybe 1%, yeah. And we're trying to deduce information from this 1%, yeah. And what is known from this patients that died with COVID is that the virus reaches the brain, yeah. So in large cohorts, I think we have studied a pretty large cohort with around 100 patients now. About 50% of all patients have virus detectable in the brain, but it is very little in the brain, not too much, you know. I mean, the amounts are way, way less than in the lung or in the pharynx, yeah. So it reaches the brain. And then what it does in the brain, this is also something that we and others have studied. So it doesn't cause massive viral encephalitis that we are seeing sometimes in classical neurotropic viruses, like, you know, herpes simplex virus, for example. It's a classical example of a neurotropic virus. This virus causes a deadly brain disease with necrotizing encephalitis. Yeah? We don't see this, but we rather see an immune reaction that is triggered by presence of the virus. And it seems that this immune reaction is causing this neuroimmune picture we see, yeah, with microglia nodules, with recruitment of lymphocytes, and this then leads to execution of signaling pathways, which, you know, which might not be good for the brain.